Good morning. And this is Dr. Thomas Nijupadam with another episode about Invisalign. And Invisalign has been changing lives of people by giving them a brighter, better smiles and with aligned teeth. We look, your teeth look much brighter, and it is also to keep it clean and very neat. Because most of the time, what I see with my patients is that they tend to keep their teeth very clean, but they have crowding in the lower anteriors or the upper anteriors. That makes a lot of food getting in between, or the stings being there between the teeth. And Invisalign has helped most of these people with much better, well-aligned, proclined teeth have become much more retroclined. The smiles have become better, smiles have become fuller with non-extraction cases. We have done some amazing stuff. So today we are going to talk about Invisalign and how Invisalign can change, and I will show you some of these digital videos which we have prepared for, by which the smiles have been better with most of these cases. We've been doing a lot of Invisalign cases. I will not take too much time on introduction. I will just go into my Invisalign cases. I will just show you one case which is of extraction case, wherein Invisalign can do extraction cases when compared to the rest of the clear aligners. Clear aligners are also evolving, but Invisalign was the first to get into this clear aligner therapy, and it has been doing wonders across the world. And I'd like to just mention about this case now. This patient is a case wherein we had a lot of proclination. It was a Bimax case, or the tooth was always proclined like this. So before we start, I'd like to tell you how an Invisalign case is being registered. So the patient walks in and we do a counseling. We tell them what are the problems. The patient tells me what he wants to do about it, and then we make impressions, and then we do it digitally, and then we keep it onto the computer. Then we get a 3D model, as you can see. It's a pliable model I can see from the back side, which you can never see otherwise. So basically it helps me to see the whole teeth in all the directions, and how he bites, and how each arch looks like, and everything can be seen with the help of this way of correcting this. So now once this is done, then we plan this treatment. And then what we have done for this case is actually to extract the case, extract 2 premolars. These 2 premolars were extracted, and then we have taken the teeth back like this. So you can see that the tooth is actually getting pulled back, and then what happens is it becomes much more aligned. From one more side, that is from this side, if you can see, the tooth was looking like that. Then we have extracted these 2 teeth, and then you can see that the teeth is getting pulled one by one, and then it goes back, and then we get a better smile. So this is how Invisalign does it. I can show you from another side if you want to see it from the front. What happened? It doesn't see much, but I'll show you a little more zoomed version so that you can see that. I can see all these things. That is the beauty of Invisalign, the program. So what happens is then you can see it moving like that, and then the tooth goes back like that. So I'd like to tell you all these things just because this is the beauty of Invisalign. We can show you how each tooth moves. If you want to see just that one, then I can show you that how the tooth is extracted. Then we can. In Invisalign, we have one more thing, that we can actually, the extraction space can be masked using a small Pontic there, or we put some composite there in the aligner itself, so that nobody sees that it has been extracted while you're wearing the aligner. So it's a beautiful way of treating the Invisalign cases. I will show you one more case without extraction. If you want to see one case without extraction, then I can show you that also. Let me show you this case. It will come. See, the CleanCheck Pro is the new new software where you can play around. So you can see in this case there is a lot of proclination. What we what you can see is there is a lot of proclination. You can see that the tooth is actually looking forward. But what we do is we do around 0.4 millimeters, which is very negligible, 0.3, 0.5 millimeters of tooth preparation using some stupors. Then we take it, you can see how well the tooth gets aligned actually. So you can see it from another view that is like this. Then you can see it much better. And let me show you how the tooth comes down. So you can see how well the tooth gets aligned. So now, so this is what I would like to tell you. Thank you for having another live with me. So we'll come up with newer live and videos. Please subscribe to me, and we'll show you how things move. We'll show you some of the cases in the next videos. Please subscribe me and keep me posted so that we can have all these wonderful videos be shown so that you can learn and then you can do much better smiles. Thank you very much.